Imagine a condition that silently affects millions, often without them even knowing. Diabetes is more than just high blood sugar. It's a complex health issue that impacts daily life in ways you may not expect. From how your body processes food to how you feel every single day, diabetes can change everything. But what if I told you that understanding just a few key facts could make all the difference? Let's break down the truth about diabetes and uncover 122 facts that everyone needs to know. Whether you're here to learn more for yourself, support a loved one, or stay informed, these facts are essential. Grab your pen and jotter right now, because what you will be getting from this video is pure gold. You won't want to miss a single detail. Here is an outline of what you will be learning in this video course. 1. What is diabetes? 2. Type of diabetes. 3. How diabetes develops. 4 causes of diabetes. 5. Symptoms of diabetes. 6. Diagnosis of diabetes. 7. Treatment of diabetes. 8. Your age versus diabetes. 9. False beliefs about diabetes. 10. Statistics on diabetes. 11. How to care for loved ones with diabetes. 12. Financial impact of diabetes on patients. 13. Final key. Outline 1. What is diabetes? Firstly, let's explore the essential information about diabetes to build a solid foundation. 1. Diabetes happens when your body has trouble using sugar from food. Imagine you eat a piece of bread. Normally, your body breaks it down into sugar, which gives you energy. But if you have diabetes, your body can't use that sugar properly, so it stays in your blood, causing problems. 2. When you have diabetes, the sugar stays in your blood instead of being used by your body cells. This is like if you keep putting more and more water into a cup that's already full. Eventually, it will overflow. High blood sugar is like that overflowing cup. There's too much sugar in the blood, and it can't go where it needs to. This overflow can cause harm to your body over time, just like spilled water can damage the floor. 3. Diabetes is a long-term condition. Diabetes isn't something that just goes away. It's a long-term condition that needs attention every day. Imagine owning a plant that needs watering and sunlight every day to stay healthy. If you forget to water it, the plant won't grow well, and it might even die. In the same way, managing diabetes requires daily care, like eating the right foods, exercising, and sometimes taking medicine. It's something you live with, but with proper care, you can keep it under control. For managing diabetes is all about balance. That is keeping just the right amount of sugar in your blood. It's like balancing a seesaw. You don't want one side to go too high or too low. If your blood sugar is too high, it can cause damage to your body. If it's too low, you won't have enough energy to do your day-to-day activities. The goal is to keep it balanced so everything works smoothly. 5. Diabetes is a very common disease. Imagine you're in a room with 10 people. Chances are 1 or 2 of them might have diabetes. It's that common. 6. Anyone can get diabetes. Whether you're a child or an adult, rich or poor, anyone can develop diabetes. It's like catching a cold. No one is completely safe from it. 7. Your body hormone called insulin helps control sugar. Insulin is like a key that opens the door for sugar to enter your body cells, giving you energy. Without this key, the sugar stays in your blood, making you feel tired. Keep this in mind, insulin helps control your body's sugar level. 8. Without insulin, sugar builds up in your blood. When sugar builds up in your blood, it's like having too many cars on the road during rush hour. Everything slows down and problems happen like accidents. Outline 2. Types of diabetes. Now let's discuss the various types of diabetes. 9. No 1. There are 2 main types. There's type 1 and type 2 diabetes. Think of type 1 as a car with no fuel, insulin, so it can't run. Type 2 is like having a car with fuel, but the engine in your body isn't using the fuel efficiently. 10. Note 2. In type 1 diabetes, your body doesn't make insulin at all. It's like trying to bake a cake without flour. No matter what, the cake won't turn out right. Type 1 diabetes is when the body stops making insulin, which is needed to help sugar enter the cells for energy. Imagine if your body is a factory that needs a special tool to do its work, but that tool suddenly breaks down. Without it, the factory can't run properly. In type 1 diabetes, the body's tool for handling sugar, insulin, is missing. This usually happens in children and young adults. People with type 1 diabetes need to take insulin every day, like how a factory might need to bring in a new tool to keep working. 11. Note 3. In type 2 diabetes, your body doesn't use insulin well. Type 2 diabetes is more common and usually happens in adults, but it can also affect children. In this type, the body still makes insulin, but it doesn't use it well. Imagine you're trying to unlock a door with a key, but the key is bent. The door might open a little, but it's hard work. The key, insulin, is there, but it can't open the door properly to let the sugar into the cells. That's how your body struggles to use insulin. As a result, sugar stays in the blood, and over time, this can cause health problems. People with type 2 diabetes might manage it with a healthy diet, exercise, and sometimes medicine. 12. Note 4. Other types of diabetes include gestational diabetes and prediabetes. 13. Note 5. Gestational diabetes happens only during pregnancy. Think of it as a temporary situation where the body struggles to handle sugar while a woman is expecting a baby. It's like if your car starts acting up only when you have extra weight in it, like carrying heavy luggage. After the baby is born, this type of diabetes usually goes away. However, both the mother and baby are at a higher risk of developing type 2 diabetes later in life. 14. Note 6. Prediabetes is when blood sugar levels are higher than normal, but not high enough to be considered diabetes yet. It's like getting a warning light in your car before something goes seriously wrong. This is a signal that you need to make some changes, like eating healthier and exercising more, to prevent type 2 diabetes. It's a wake-up call to start taking care of your body before it turns into full-blown diabetes. Outline 3. How diabetes develops. Now let's dive in to learn about how diabetes develops. 15. Note 1. Diabetes begins when the body starts having trouble with how it handles sugar in the blood. Imagine you're trying to pour water into a cup, but the cup has a small hole in it. At first, you might not notice the water leaking out, but over time, it becomes clear that something is wrong. Similarly, in the early stages of diabetes, the body struggles to keep blood sugar levels normal, but the problem isn't always obvious right away. 16. Note 2. Insulin is like a helper that moves sugar from the blood into the body's cells, where it's used for energy. When diabetes begins to develop, the body either doesn't make enough insulin or the insulin it makes doesn't work well. This is like having a key that's either missing or broken, making it hard to open the door. Without this key working properly, sugar can't get into the cells, so it stays in the blood. 17. Note 3. When the body senses that sugar is building up in the blood, it tries to make more insulin to help. This is like a factory that starts working overtime to keep up with demand. But just like a factory can't keep running at full speed forever, the body can't keep up with the extra work. Eventually, the insulin-producing cells get tired and can't produce enough insulin anymore, making the blood sugar problem worse. 18. Note 4. As the body struggles to manage sugar, more and more sugar stays in the blood instead of going into the cells. Imagine a highway with too many cars on it. Traffic slows down, and eventually everything comes to a stop. In diabetes, the traffic jam of sugar in the blood starts causing problems throughout the body. This high blood sugar is the main issue in diabetes and can lead to other health problems if not managed. 19. Note 5. Because the sugar isn't getting into the cells where it's needed, the cells don't have enough energy to do their jobs. It's like a town where the power plant isn't supplying enough electricity. Lights start flickering, machines slow down, and nothing works as well as it should. This lack of energy in the cells can make people with diabetes feel tired and weak, even if they are eating enough food. 20. Note 6. As diabetes develops, the body starts to show signs that something is wrong. It's like when a car's warning lights come on to tell you that there's a problem with the engine. These signs might include feeling very thirsty, needing to use the bathroom a lot, and losing weight without trying. These are the body's ways of signaling that it's struggling to manage sugar properly. 21. Note 7. Once diabetes develops, it usually becomes a long-term condition that requires ongoing management. Imagine a garden that needs regular watering, weeding, and care to stay healthy. Without daily attention, the garden will wither and die. Similarly, managing diabetes requires daily care, like watching what you eat, exercising, and sometimes taking medicine to keep blood sugar levels in check. 22. Note 8. The earlier diabetes is detected, the better it can be managed. It's like finding a small crack in your house's foundation before it turns into a big problem. If diabetes is caught early, it's easier to manage and can prevent more serious complications later on. That's why it's important to pay attention to any signs or risk factors and get checked by a doctor if you think you might be at risk. Outline 4. Causes of diabetes. Now let's delve into the causes of diabetes and discover what triggers this illness. 23. Cause 1. Genetics. One of the main causes of diabetes is genetics, which means it can be passed down from parents to their children. Think of it like inheriting your parents' eye color or height. If your parents or grandparents had diabetes, you're more likely to develop it too. It's like receiving a family recipe that you might not want, but it's still a part of your life. This doesn't mean you will definitely get diabetes, but it does mean you have a higher chance. 24. Cause 2. Being overweight. Carrying extra weight, especially around your belly, is a big cause of type 2 diabetes. It's like putting too much weight on a bicycle. Eventually, the tires won't be able to handle it and will start to wear out. In the body, extra fat makes it harder for insulin to work properly. This is called insulin resistance, where the body can't use insulin effectively, leading to high blood sugar levels. 25. Cause 3. Lack of physical activity. Not moving around enough can also cause diabetes. Think of your body like a car. If you don't drive it often, it can start to rust and break down. When we don't exercise or stay active, our body struggles to use sugar for energy, leading to a buildup of sugar in the blood. Regular physical activity helps the body use insulin better, like keeping that car running smoothly. 26. Cause 4. Unhealthy eating habits. Eating too much junk food, sugary drinks, and processed foods can cause diabetes. It's like feeding your car the wrong type of fuel. Eventually, it won't run as well. When we eat too many unhealthy foods, our body gets overwhelmed with sugar, and over time, this can lead to diabetes. A diet high in fruits, vegetables, and whole grains is like giving your body the right fuel to keep it running well. 27. Cause 5. Age. As people get older, the risk of developing type 2 diabetes increases. It's like a machine that wears down over time. The older it gets, the more likely it is to have problems. The body's ability to use insulin properly can decrease with age, making it harder to manage blood sugar levels. This doesn't mean everyone will get diabetes as they age, but it's something to watch out for. 28. Cause 6. High blood pressure. Having high blood pressure can also lead to diabetes. Imagine trying to pump water through a hose that's too tight. It's going to put a lot of strain on the pump. In the same way, high blood pressure puts extra strain on the heart and blood vessels, which can lead to problems with insulin and blood sugar. Managing blood pressure is important to reduce the risk of developing diabetes. 29. Cause 7. High cholesterol. High cholesterol is like having too much grease in your car's engine. It can clog things up and cause problems. When cholesterol levels are high, it can lead to insulin resistance, making it harder for the body to use sugar properly. This can eventually cause diabetes. Eating a balanced diet and staying active can help keep cholesterol levels in check. 30. Cause 8. Changes in hormones. Certain changes in hormones, such as during pregnancy, can also cause gestational diabetes. For some women, pregnancy causes the body to struggle with insulin and sugar levels, leading to gestational diabetes. Although it usually goes away after childbirth, it increases the risk of developing type 2 diabetes later on. 31. Cause 9. Stress and mental health. Long-term stress and poor mental health can contribute to the development of diabetes. Imagine trying to carry a heavy load for a long time. Eventually, it wears you down. Chronic stress can make it harder for the body to use insulin, leading to high blood sugar. Managing stress and taking care of mental health are important in preventing diabetes. 32. Cause 10. Not getting enough sleep. Not getting enough sleep or having poor quality sleep can also cause diabetes. It's like running on low battery. You can't function properly. Lack of sleep affects how the body uses insulin and can lead to higher blood sugar levels over time. Regular, Good quality sleep is essential for keeping your body healthy and reducing the risk of diabetes. 33. Cause 11. Smoking. Smoking can also cause diabetes. It's like adding poison to your body. Over time, it damages everything. Smoking increases the risk of insulin resistance, making it harder for the body to manage blood sugar. Quitting smoking is one of the best things you can do for your health, including reducing your risk of diabetes. 34. Cause 12. Certain medications. Some medications can cause diabetes as a side effect. It's like taking a medicine that fixes one problem but causes another. For example, long-term use of steroids can lead to high blood sugar and eventually diabetes. Always talk to your doctor about the side effects of any medications you are taking, especially if you are at risk for diabetes. Outline 5. Symptoms of diabetes. Now, let's dive into the common symptoms that may indicate diabetes. 35. Symptom 1. Feeling thirsty all the time. One of the most common symptoms of diabetes is feeling very thirsty all the time, no matter how much you drink. It's like being in the hot sun all day without water. No matter how much you drink, you still feel thirsty. This happens because high blood sugar levels make your body pull water from your tissues, making you feel dehydrated and constantly thirsty. 36. Symptom 2. Needing to urinate frequently. Another sign of diabetes is needing to go to the bathroom more often, especially at night. It's like a faucet that won't stop dripping. You keep feeling the need to relieve yourself. This happens because your body tries to get rid of the extra sugar in your blood through urine, which makes you urinate more frequently. This can be very bothersome and disrupt your sleep. 37. Symptom 3. Feeling very hungry, even after eating. People with diabetes often feel very hungry, even after eating a meal. Imagine your stomach is like a fuel tank that never gets full. No matter how much you eat, you still feel empty. This happens because your body isn't using the sugar from food properly, so your cells are still asking for energy, making you feel hungry all the time. 38. Symptom 4. Extreme fatigue and tiredness. Feeling extremely tired or weak is another common symptom of diabetes. It's like trying to run a car with no fuel. You just don't have the energy to keep going. Since your body can't use sugar for energy properly, you might feel drained and unable to do even simple tasks. This fatigue can be overwhelming and affect your daily life. 39. Symptom 5. Blurry vision. Diabetes can cause your vision to become blurry. It's like looking through a foggy window. Everything looks unclear and out of focus. High blood sugar levels can affect the tiny blood vessels in your eyes, making your vision blurry. If not treated, this can lead to more serious eye problems, so it's important to pay attention if you notice changes in your eyesight. 40. Symptom 6. Slow healing wounds or cut. If you have diabetes, you might notice that cuts, sores, or wounds take a long time to heal. High blood sugar levels can damage your blood vessels and nerves, which makes it harder for your body to heal properly. This can lead to infections if not taken care of. 41. Symptom 7. Unexplained weight loss. Some people with diabetes lose weight suddenly, even if they haven't changed their diet or exercise routine. It's like your body is burning fuel even when you're not driving anywhere. This happens because your body starts breaking down muscle and fat for energy when it can't use sugar properly. If you notice unexplained weight loss, it's important to see a doctor. 42. Symptom 8. Numbness in hands and feet. Numbness in your hands and feet can be a sign of diabetes. It's like your limbs have fallen asleep and won't wake up. This is caused by nerve damage from high blood sugar levels, a condition called neuropathy. It usually starts with a tingling sensation and can become painful over time. If you notice these symptoms, it's important to get them checked out. 43. Symptom 9. Dry skin and itching. Diabetes can cause your skin to become very dry and itchy. Imagine having a constant itch that never goes away, making you uncomfortable all the time. High blood sugar levels can affect your skin's moisture levels, leading to dryness and itching. This can be particularly noticeable on your arms, legs, and feet. Keeping your skin moisturized can help, but it's important to manage your blood sugar levels as well. 44. Symptom 10. Dark patches on the skin. Some people with diabetes develop dark, velvety patches of skin, usually around the neck, armpits, or groin. It's like parts of your skin have been stained or tanned. This condition, called acanthosis nigricans, can be an early sign of insulin resistance, where your body isn't using insulin properly. If you notice these dark patches, it's a good idea to get checked for diabetes. 45. Symptom 11. Feeling irritable or moody. Diabetes can affect your mood, making you feel irritable or more easily upset. It's like having a short fuse. Small things that didn't bother you before might now make you angry or frustrated. This can happen because blood sugar levels that are too high or too low can affect your brain and how you feel. Managing your diabetes can help keep your mood more stable. 46. Symptom 12. Frequent infections. People with diabetes are more prone to infections, like gum infections, bladder infections, or skin infections. It's like having a defense system that's always on the lookout for intruders but isn't strong enough to fight them off. High blood sugar can weaken your immune system, making it easier for infections to take hold. Keeping your blood sugar levels under control can help reduce the risk of these infections. 47. Symptom 13. Craving sweet foods. Some people with diabetes find themselves craving sweet foods more often. It's like your body is telling you it wants more sugar, even though it can't handle the sugar it already has. This craving happens because your cells are starved for energy, so they send signals to your brain that you need more food, especially sugar. This can create a cycle of eating more sweets, which makes diabetes worse. 48. Symptom 14. Feeling dizzy or lightheaded. If your blood sugar levels drop too low, you might feel dizzy or lightheaded. It's like standing up too quickly and feeling your head spin. This happens because your brain needs sugar to function, and if there isn't enough in your blood, you can start to feel faint or unsteady. Eating regular meals and snacks can help keep your blood sugar levels steady and prevent dizziness. 49. Symptom 15. Bad breath with a fruity smell. Some people with diabetes develop a fruity smelling breath, which can be a sign of high blood sugar levels. It's like your breath smells sweet, even though you haven't eaten anything fruity. This happens when your body starts breaking down fat for energy instead of sugar, producing chemicals called ketones. If you notice this fruity smell on your breath, it's important to get medical help right away, as it could be a sign of a serious condition called ketoacidosis. Outline 6. Diagnosis of diabetes. Diagnosis is the process of finding out what's wrong with your body. It's like a mechanic checking your car to see why it's making a strange noise. Now, let's discuss the various methods used to diagnose diabetes. 50. Diagnosis 1. Going to the doctor for a checkup. The first step to diagnosing diabetes is going to the doctor for a checkup. Imagine you've been feeling tired, thirsty, or needing to go to the bathroom a lot. You go to the doctor to find out what's wrong. The doctor will ask about your symptoms, how you've been feeling, and your daily habits, like what you eat and how active you are. This helps the doctor decide if you need tests to check for diabetes. 51. Diagnosis 2. Blood sugar test, finger prick test. A common test to diagnose diabetes is the blood sugar test, also known as the finger prick test. Imagine the doctor or nurse pricking your finger with a small needle to get a drop of blood. They then use a special machine to check how much sugar is in your blood. It's a quick test that can give results right away. If your blood sugar is higher than normal, it could mean you have diabetes. 52. Diagnosis 3. Fasting blood sugar test. Another way to check for diabetes is the fasting blood sugar test. Imagine the doctor asking you not to eat or drink anything except water for about 8 hours, usually overnight. You go to the doctor in the morning, and they take a sample of your blood. This test shows how much sugar is in your blood when you haven't eaten for a while. If your fasting blood sugar is too high, it could mean you have diabetes. 53. Diagnosis 4. A1C test, hemoglobin A1C test. The A1C test is another important test for diagnosing diabetes. Imagine the doctor taking a small sample of your blood, just like for other blood tests. The A1C test looks at your average blood sugar levels over the past 2 to 3 months. It's like looking at a report card that shows how well your blood sugar has been controlled over time. If your A1C level is too high, it could mean you have diabetes. 54. Diagnosis 5. Oral glucose tolerance test. For some people, the doctor might use an oral glucose tolerance test to diagnose diabetes. Imagine the doctor giving you a very sweet drink, and then taking your blood at different times afterward. This test checks how well your body handles sugar. If your blood sugar levels are still high after 2 hours, it could mean you have diabetes. This test is often used to check for gestational diabetes in pregnant women. 55. Diagnosis 6. Random blood sugar test. Sometimes the doctor might do a random blood sugar test. Imagine going to the doctor at any time of the day without needing to fast. The doctor takes a blood sample to check your sugar levels. If your blood sugar is high, even though you haven't been fasting, it could mean you have diabetes. This test is useful if you have symptoms and need a quick diagnosis. 56. Diagnosis 7. Urine test. In some cases, the doctor might check your urine pee for signs of diabetes. Imagine the doctor asking you to pee in a cup. They then test your urine for sugar or other substances that shouldn't be there. High sugar levels in your urine could be a sign of diabetes. While not as common as blood tests, urine tests can help the doctor decide if more testing is needed. Outline 7. How to treat diabetes. Now, let's discuss the various ways diabetes can be treated and managed. 57. Treatment Tip 1. Healthy eating. One of the most important ways to treat diabetes is by eating healthy foods. Imagine your plate filled with vegetables, whole grains, lean meats, and fruits. Eating these foods helps keep your blood sugar level steady. For example, instead of drinking sugary sodas, you could drink water or natural fruit juice. Eating smaller portions more often can also help, like having an apple instead of a big slice of cake. Healthy eating is like putting the right fuel in your body's engine, so it runs smoothly. 58. Treatment Tip 2. Regular exercise. Regular exercise is another key part of treating diabetes. Imagine taking a walk every day, playing with your kids, or dancing to your favorite music. Exercise helps your body use sugar better, which lowers your blood sugar levels. It doesn't have to be hard exercise. Even simple activities like gardening, walking upstairs, or stretching can make a big difference. Think of exercise as giving your body a gentle push to stay healthy and strong. 59. Treatment Tip 3. Use of medication. Some people with diabetes need to take medicine to control their blood sugar levels. Imagine the doctor giving you pills to take every day or showing you how to use a small needle to inject insulin. These medicines help your body keep blood sugar at the right level. Just like you would take medicine when you have a headache, taking diabetes medicine helps you feel better and stay healthy. It's important to take the medicine exactly as the doctor says to keep your diabetes under control. 60. Treatment Tip 4. Monitoring blood sugar levels. Checking your blood sugar levels regularly is a big part of diabetes treatment. Imagine using a small device that pricks your finger to get a drop of blood, then reading the sugar level on a screen. This tells you if your blood sugar is too high or too low. Just like you check the fuel gauge in your car to know when to fill up. Checking your blood sugar helps you know when to eat, exercise, or take your medicine. It's a way to keep track of how well you're managing your diabetes. 61. Treatment Tip 5. Understanding how insulin works. For some people, especially those with type 1 diabetes, taking insulin is necessary. Imagine insulin as a key that helps sugar move from your blood into your cells, where it's used for energy. Without enough insulin, sugar stays in your blood, causing high blood sugar levels. Taking insulin helps keep your blood sugar in balance. Just like using the right amount of gas keeps your car running smoothly. Your doctor will show you how to take insulin safely and explain how much you need each day. 62. Treatment Tip 6. Learning about hypoglycemia, low blood sugar. Sometimes your blood sugar can drop too low, a condition called hypoglycemia. Imagine feeling shaky, dizzy, or really hungry. This could mean your blood sugar is too low. To treat it, you might eat something sweet, like a piece of candy or drink some fruit juice. Just like you might need a quick snack when you're feeling weak, treating low blood sugar quickly can help you feel better. Your doctor will teach you how to recognize the signs and what to do if your blood sugar gets too low. 63. Treatment Tip 7. Regular checkups with the doctor. Regular visits to the doctor are important to keep your diabetes under control. Imagine going to the doctor every few months to check how you're doing. The doctor might check your blood sugar levels, ask about your eating and exercise habits, and make sure your medicine is working well. Think of these checkups like taking your car to the mechanic for a tune-up. It helps keep everything running smoothly and catches any problems early. 64. Treatment Tip 8. managing stress. Stress can make it harder to control your diabetes. Imagine feeling very worried or upset. This can cause your blood sugar to go up. Finding ways to relax, like talking to a friend, doing something you enjoy, or practicing deep breathing, can help lower your stress. Think of it like taking a break when you're tired. Managing stress gives your body a chance to rest and recover, helping you stay healthier. 65. Treatment Tip 9. Learning about complications. It's important to know about the complications that can happen if diabetes is not managed well. Imagine the doctor telling you about things like heart problems, nerve damage, or eye issues that can happen over time. But remember, with good treatment, you can lower your chances of these complications. Just like you would avoid driving on a rough road to keep your car safe. Taking care of your diabetes helps you avoid health problems in the future. 66. Treatment Tip 10. Having a support system. Having people who support you can make managing diabetes easier. Imagine talking to your family or friends about your condition and how they can help you. Maybe they can join you for walks, help you prepare healthy meals, or remind you to take your medicine. It's like having a team cheering you on. With their support, you can stay strong and healthy. 67. Treatment Tip 11. Staying educated about diabetes. Learning as much as you can about diabetes helps you take control of your health. Imagine reading simple information about diabetes, attending a diabetes class, or talking to your doctor about new treatments. The more you know, the better you can manage your condition. It's like learning the rules of a game. Understanding how diabetes works helps you make the best moves to stay healthy. 68. Treatment Tip 12. Eating regularly. It's important to eat regularly to keep your blood sugar level steady. Imagine having 3 small meals a day, with snacks in between. Skipping meals can cause your blood sugar to drop, just like a car running out of gas. Eating at regular times helps keep your energy up and your blood sugar in balance, making it easier to manage your diabetes. Outline 8. Age versus diabetes. Now, let's discuss how age plays a role in the likelihood of developing diabetes. 69. Note 1. Diabetes is more common in older adults. As people get older, their chances of developing diabetes increase. Imagine how your body changes as you age, like getting wrinkles or needing glasses. Just as these changes happen naturally, your body also finds it harder to manage blood sugar levels over time. For example, someone in their 60s or 70s is more likely to develop diabetes than someone in their 20s. This doesn't mean everyone will get diabetes when they get older, but the risk is higher. 70. Note 2. The body's insulin becomes less effective with age. Insulin is the hormone that helps your body use sugar for energy. As you age, your body may not use insulin as well as it used to. Imagine trying to open a door with a rusty key. It's not as smooth as when the key was new. Similarly, the insulin in older bodies might not work as efficiently, making it harder to keep blood sugar levels normal. This can lead to type 2 diabetes, which is more common in older adults. 71. Note 3. Slower metabolism with age. Metabolism is how your body turns food into energy. As you age, your metabolism slows down. Think of it like a car engine that doesn't run as fast as it used to. This slower metabolism can cause your body to gain weight more easily, which can increase the risk of diabetes. For example, you might notice that you gain weight even if you're eating the same amount as when you were younger. Extra weight makes it harder for your body to manage blood sugar, raising the risk of diabetes. 72. Note 4. Changes in physical activities due to age. As people get older, they often become less active. Imagine how you might prefer sitting in a comfortable chair rather than running around like you did when you were young. Less physical activity can lead to weight gain and make it harder for your body to use insulin properly. For example, older adults who don't exercise regularly are more likely to develop diabetes. Staying active, even by doing simple exercises like walking or gardening, can help lower this risk. 73. Note 5. Weaker immune system with age. The immune system helps protect your body from illnesses. As you age, your immune system may not work as well, which can affect how your body manages blood sugar. Imagine your body's defense system getting a bit slower to respond to threats. This can make it easier for blood sugar levels to go out of control, increasing the risk of diabetes. For instance, Older adults who get sick might have a harder time recovering, and this stress on the body can lead to higher blood sugar levels. 74. Note 6. Increased risk of other health problems due to age. As people age, they are more likely to develop other health problems like high blood pressure or high cholesterol, which are also linked to diabetes. Imagine having multiple issues to deal with at once. It makes everything more complicated. For example, an older person with high blood pressure might also struggle with blood sugar control, increasing the risk of diabetes. Managing these other health problems is important to reduce the risk of diabetes. 75. Note 7. Changes in appetite and diet due to age. As people age, their appetite and diet might change, sometimes leading to poor nutrition. Imagine not feeling as hungry as you used to or losing your taste for certain foods. This can lead to eating fewer healthy foods and more processed or sugary foods, increasing the risk of diabetes. For example, older adults might skip meals or eat more snacks, which can cause blood sugar levels to rise and fall in unhealthy ways. 76. Note 8. Delayed diagnosis of diabetes in older adults. Sometimes, diabetes isn't diagnosed right away in older adults because the symptoms can be mistaken for normal aging. Imagine feeling tired, thirsty, or needing to use the bathroom often. These could be seen as just getting older, but these are also symptoms of diabetes. For example, an older adult might not realize they have diabetes until it causes more serious health problems. Regular checkups with the doctor are important to catch diabetes early. 77. Note 9. Preventing diabetes as you age. While the risk of diabetes increases with age, it's still possible to prevent it by making healthy choices. Imagine deciding to eat more vegetables, be more active, and visit the doctor regularly. These choices can help keep your blood sugar levels in check, even as you get older. For example, an older adult who eats a balanced diet, exercises regularly, and keeps a healthy weight can lower their risk of developing diabetes. Outline 9. False beliefs about diabetes. Now, it's time to uncover the false beliefs and misconceptions about diabetes. 78. False belief 1. Only overweight people get diabetes. Truth. Diabetes can affect anyone, not just overweight people. Imagine a person who is slim but still develops diabetes. This can happen because diabetes is influenced by many factors, not just weight. For example, someone with a normal weight but who doesn't exercise or eats a lot of sugary foods can still get diabetes. It's like thinking only certain types of cars need oil changes. All cars, regardless of their size, need regular care. 79. False belief 2. Diabetes is only caused by eating too much sugar. Truth. While eating too much sugar is not good for your health, it's not the only cause of diabetes. Diabetes is influenced by genetics, lifestyle, and other factors. For example, someone with a family history of diabetes might develop it even if they don't eat a lot of sugar. It's important to have a balanced diet, not just cut out sugar. 80. False belief 3. People with diabetes can't eat carbohydrates. Truth. People with diabetes can eat carbohydrates, but need to manage how much and what type. Imagine carbs as different types of fuel for your body. It's not that you can't have any fuel. You just need to choose the right kind and amount. For example, whole grains and fruits provide healthy carbs, while sugary snacks might cause problems. Managing carbs means balancing them with other foods and staying aware of portion sizes. 81. False belief 4. Insulin is only for people with severe diabetes. Truth. Insulin can be needed for different types of diabetes and at various stages. Imagine insulin like a tool that helps your body manage sugar levels. Some people with type 1 diabetes need insulin from the start, while people with type 2 diabetes might need it later. For example, someone with type 2 diabetes might start with pills, but later need insulin to help control their blood sugar. 82. False belief 5. Diabetes is a result of bad habits only. Truth. Diabetes can be influenced by many factors, including genetics and age. Some people might have diabetes even if they have good habits, due to their family history or other reasons. For instance, someone might develop diabetes even if they eat well and exercise, simply because of their genetic makeup. 83. False belief 6. People with diabetes can't lead normal lives. Truth. People with diabetes can live full, normal lives with proper management. Think of diabetes like having a special routine to follow, similar to having a specific schedule for taking medicine. For example, someone with diabetes can still travel, work, and enjoy activities, as long as they manage their condition with their doctor's help. It's about adjusting and finding ways to live well with diabetes. 84. False belief 7. Diabetic patients can't eat fruits. Truth. Fruits are healthy and can be eaten in moderation. Imagine fruits as colorful, nutritious snacks that can be part of a healthy diet. It's important to choose fruits that don't cause blood sugar spikes, like berries or apples. 85. False belief 8. Diabetes is contagious. Truth. Diabetes cannot be spread from person to person. Think of diabetes like a personal health condition, not like a cold that you can catch from someone else. It's something that happens inside your body, not something you can get by being close to someone with diabetes. For example, you can be around someone with diabetes without worrying about catching it yourself. 86. False belief 9. Diabetes only affects older adults. Truth. Diabetes can affect people of all ages, including children and teenagers. Think of diabetes like a condition that doesn't discriminate by age. For example, type 1 diabetes is often diagnosed in children or young adults, while type 2 diabetes is more common in older adults, but can also occur in younger people, especially if they have risk factors like obesity. 87. False belief 10. Diabetes is just a minor issue. Truth. Diabetes is a serious health condition that needs proper care. It's not just a small problem, but something that affects many parts of your body. Think of it like a car that needs regular maintenance to run well. Without proper care, diabetes can lead to serious issues like heart disease, kidney problems, or vision loss. For example, taking diabetes seriously and following your treatment plan helps prevent these complications and keeps you healthy. 88. False belief 11. Only people with diabetes need to worry about blood sugar levels. Truth. Monitoring blood sugar levels is important for people with diabetes, but also for those at risk. Imagine checking your fuel gauge even if you're not running low. It helps prevent problems. People at risk for diabetes, or those who are pre-diabetic, should also monitor their blood sugar to avoid developing full-blown diabetes. Regular checkups and monitoring help everyone manage their health better. Outline 10. Statistics about diabetes. Now let's dive into the statistics that reveal the impact of diabetes worldwide. 89. Statistics 1. Diabetes affects a large number of people around the world. Imagine a big city where many people have diabetes. Globally, over 400 million people live with diabetes. That's like filling a huge stadium with people who have diabetes. This shows how common the condition is worldwide. 90. Statistics 2. The number of diabetes cases is growing. Think of it like a balloon that keeps getting bigger. Over the past few decades, diabetes cases have increased significantly. For example, in the past 20 years, the number of people with diabetes has more than doubled, showing that more people are developing the condition. 91. Statistics 3. Diabetes can affect people of all ages, but it's more common in older adults. Imagine a classroom where more of the older students have diabetes compared to the younger ones. Most people with diabetes are over the age of 45, but children and younger adults are also affected, especially with type 1 diabetes. 92. Statistics 4. Type 2 diabetes is more common than type 1. Think of it like a big group where most people have type 2 diabetes. About 90% of diabetes cases are type 2, while type 1 makes up around 10%. This means type 2 diabetes affects many more people than type 1. 93. Statistics 5. Diabetes affects both men and women, but in some places it's slightly more common in men. Imagine a room where there are just a few more men than women with diabetes. The difference isn't huge, but overall, men might be slightly more likely to have diabetes than women. 94. Statistics 6. Diabetes also affects children, though it's less common. Think of a playground where a few kids have diabetes. Type 1 diabetes is more common in children and young adults. 95. Statistics 7. Diabetes and obesity. There is a strong link between diabetes and obesity. People who are overweight or obese are more likely to develop type 2 diabetes. 96, Statistics 8. People with diabetes are at higher risk for heart disease. About 70% of people with diabetes also have heart disease or other related conditions. Managing diabetes is important to reduce the risk of heart problems. Outline 11. How to care for loved ones with diabetes. Now let's dive into how to provide care and support for loved ones with diabetes. 97. Tip 1. Learn about diabetes. Understanding diabetes helps you care better. Imagine learning the rules of a game to play it well. Read simple guides or talk to doctors to know what diabetes is and how it affects your loved one. Knowing basic things like what diabetes is and how it's managed helps you provide better support. 98. Tip 2. Monitor blood sugar levels. Help check blood sugar levels regularly. Think of it like checking the oil in a car to keep it running smoothly. Use a glucose meter to check their blood sugar and follow the doctor's instructions. Regular checking helps ensure their blood sugar stays in a healthy range. 99. Tip 3. Encourage healthy eating. Support them in eating healthy foods. Imagine helping someone choose fruits and vegetables instead of sugary snacks. Plan meals with lots of vegetables, whole grains, and lean proteins. This helps manage diabetes and keeps their blood sugar stable. 100. Tip 4. Help with medication. Assist them in taking their diabetes medications as prescribed. Think of it like reminding someone to take their vitamins. Set up a medication schedule or use reminders to make sure they don't miss a dose. This helps keep their blood sugar under control. 101. Tip 5. Encourage physical activity. Support them in being active. Imagine taking a walk together or encouraging exercise routines. Regular physical activity, like walking or swimming, helps manage blood sugar levels and keeps them healthy. Join in or find activities they enjoy to stay motivated. 102. Tip 6. Watch for symptoms. Be alert for any changes in their health. Think of it like watching for signs of wear and tear on a machine. Look out for symptoms like extreme thirst, frequent urination, or unusual tiredness. Report these to their doctor if you notice any changes. 103. Tip 7. Provide emotional support. Offer encouragement and understanding. Imagine being a cheerleader for someone facing a tough challenge. Diabetes can be stressful, so listen, provide comfort, and offer positive support. Being there emotionally helps them cope better with the condition. 104. Tip 8. Help with doctor visits. Accompany them to medical appointments if needed. Think of it like helping with important errands. Take notes during the visit and ask questions to understand the doctor's advice. This helps ensure they follow the treatment plan correctly. 105. Tip 9. Manage stress together. Help them manage stress as it affects blood sugar. Imagine finding relaxing activities or hobbies you could do together. Stress can make diabetes harder to control, so finding ways to relax, like deep breathing exercises or enjoying hobbies, is important. 106. Tip 10. Educate the family. Make sure everyone in the family understands diabetes. Think of it like making sure all team members know the game plan. Share basic information about diabetes and how to support the person with the condition. This helps everyone in the family provide better support. 107. Tip 11. Prepare for emergencies. Know what to do in case of a diabetes emergency. Imagine having a first aid kit ready for unexpected situations. Learn how to recognize and handle low or high blood sugar emergencies and keep emergency contact numbers handy. 108. Tip 12. Help with daily tasks. Assist with daily tasks if needed. Think of it like helping a friend with chores. If they're feeling unwell or overwhelmed, help with things like cooking, shopping, or managing their daily routine. This eases their burden and helps them focus on managing diabetes. 109. Tip 13. Keep track of appointments and supplies. Help manage their schedule and diabetes supplies. Imagine keeping a calendar for important events. Track their medical appointments, medication refills, and diabetes supplies to make sure they always have what they need. 110. Tip 14. Promote good sleep. Encourage them to get enough sleep. Think of sleep as a necessary rest for a busy machine. Good sleep helps in managing blood sugar levels and overall health. Support a consistent sleep routine and create a relaxing bedtime environment. 111. Tip 15. Be patient and understanding. Show patience and understanding. Imagine supporting a friend through a difficult time. Diabetes management can be challenging, so be patient, listen, and offer help without judgment. Your support makes it easier for them to manage their diabetes. Outline 12. Financial impact of diabetes on patients. Now, let's discuss the financial impact that diabetes can have on patients. 112. Note 1. High cost of medication. Diabetes often requires regular medication, which can be expensive. Imagine needing to buy medicine every day like buying groceries. For example, insulin and other diabetes medications can cost a lot, especially if they are needed for a long time. This ongoing cost can be a big part of a patient's monthly budget. 113. Note 2. Cost of frequent doctor visits. People with diabetes need to see doctors regularly to manage their condition. Think of it like going to the doctor for regular checkups or to fix something that's broken. Each visit can cost money, including doctor fees and any tests that might be needed. For instance, seeing an endocrinologist who specializes in diabetes can add up over time. 114. Note 3. Cost of blood sugar monitoring. Monitoring blood sugar levels requires special equipment and supplies, like glucose meters and test strips. For diabetes patients, these tools are essential and can be costly. Regularly buying test strips and other supplies can be a significant expense. 115. Note 4. Expenses for diabetes-friendly food. Some people with diabetes need to buy special foods or follow a special diet. Diabetes-friendly foods can sometimes cost more than regular foods. For example, whole grain products and fresh vegetables can be more expensive, impacting the overall grocery bill. 116. Note 5. Cost of diabetes-related complications. Diabetes can lead to complications like heart disease, kidney problems, or eye issues, which require additional medical care. Imagine if a small problem turned into a bigger issue that needs extra treatment. These complications can lead to extra doctor visits, tests, and treatments, increasing overall healthcare costs. 117. Note 6. Potential loss of income. Managing diabetes can sometimes affect a person's ability to work. Imagine needing to take time off from work for doctor appointments or to manage your health. If someone needs to take time off or reduce their work hours because of diabetes, it can lead to a loss of income, adding financial stress. 118. Note 7. Travel and transportation costs. Traveling to get diabetes care, especially if specialists are far away, can be costly. This might include the cost of gas, public transportation, or even lodging if long-distance travel is needed for treatment. 119. Note 8. Financial stress from managing a chronic condition. The constant need to manage diabetes can create ongoing financial stress. Imagine worrying about paying bills while dealing with health issues. This stress can impact a person's overall well-being and make it harder to manage their condition effectively. 120. Note 9. Need for special equipment. Some people with diabetes need special equipment, like insulin pumps or continuous glucose monitors, which can be expensive. Think of it like needing to buy a new tool for a specific job. These pieces of equipment help manage diabetes, but can come with a high upfront cost and maintenance expenses. 121. Note 10. Impact on savings and retirement. The ongoing costs of managing diabetes can impact savings and retirement plans. Think of it like having to use money saved for other things to cover medical expenses. Managing diabetes might require using savings or delaying retirement plans due to the extra financial burden. 122. Note 11. Impact on family finances. The financial burden of diabetes can affect the whole family. Imagine how one person's health costs can impact the family's overall budget. Family members might need to help cover costs or adjust their spending to support a loved one with diabetes, affecting everyone's finances. Outline 13. Final key. Finally, for those living with diabetes, it can be challenging to manage the stress and uncertainty that comes with it. Putting your trust in God and praying can bring comfort and peace, easing the mind and heart. Prayer helps to release worries, reminding us that we are not alone in our struggles. By trusting in God, you can find strength and hope, knowing that He is with you every step of the way. God is the ultimate healer. Thanks so much for watching. If you enjoyed this video, please don't forget to hit the like button, share it with your friends, and subscribe to this channel for more amazing health facts. Please write in the comment section what you found most amazing about this video. Thank you so much. See you in the next video.
Join the crew, share the knowledge, learn what's new. Keep facts on health coming through. It's all here just for you. Every click helps us grow. Share the love, let it show. Teach the world what we know in the channels ebb and flow. Like, share, subscribe today. Make the world a better way. Healthier lives we can make. Clinic of 100 facts. Hey, 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 hey. Press that like, turn it blue. Share with friends, make it true. Every sub brings us to you. Facts on health we pursue. Every click helps us grow. Share the love, let it show. Teach the world what we know in the channels ebb and flow. Like, share, subscribe today. Make the world a better way. Healthier lives we can make. Clinic of 100 facts. Hey, every click helps us grow. Share the love, let it show. Teach the world what we know in the channels ebb and flow. Every click helps us grow. Share the love, let it show. Teach the world what we know in the channels ebb and flow. In the channels ebb and flow. Channels ebb and flow. Press that like, turn it blue. Share with friends, make it true. Every sub brings us to you. Facts on health we pursue. Press that like, turn it blue. Share with friends, make it true. Every sub brings us to you. Facts on health we pursue. 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 Teach the world what we know in the channels ebb and flow. Like, share, subscribe today. Make the world a better way. Healthier lives we can make. Clinic of 100 facts.